Hi there. In this video, we're going to be talking about something really common to so many people, which is jaw pain, or if you've heard it being referred to as TMJ, that's temporomandibular joint. So this joint, for us to chew, for so many, isn't balanced and symmetrical, and there's a few reasons for this actually. We've talked a lot about proper alignment of the rib cage. So the first thing that happens is when we collapse into the core from incorrect posture over time, that forces the head to come forward. And what's going to happen, because gravity is constantly affecting us, is that's going to cause the jaw to get pulled forward, so the joint itself isn't going to be articulating properly. Not to mention, we're dominant on one side of the body, even how we chew. So if you find yourself chewing more on one side than the other, there's going to be an asymmetry, and that's going to create a joint that doesn't articulate well. It's going to create adhesions, and it's going to create pain. So one really simple exercise that you can do to make a difference with this is decompressing the fascia in the jaw itself. So I'm just going to show you using two fingers. Take your third and your fourth finger and just put it right in that thick part of the jaw. And let's just apply, we can do both hands at once or one hand at a time, whatever you prefer, but let's just start with this right side and put pressure in here. It doesn't take much to find pain.
I was just gonna say, it's amazing how much pain is already there.
Yeah, and the thing, just like with block therapy, we don't rub the surface, we move into the area. But if we wanna create a little bit more movement here, we can very slowly open the jaw and close the jaw. And if we do about 10 of these, open with the exhalation, close with the inhalation as you maintain pressure. And if you're at a table, you can rest your elbow so you don't have to actually work so hard. You can just use the leverage.
Even this, D.
Even that, yeah, wherever you are. It's just all about putting pressure over time and connecting the movement with the breath. Do that on both sides, and then afterward, notice how much easier it is to open the mouth fully and close. And if you do struggle with jaw pain, let's see if we can start giving you some relief in this area. Now, having said that, just like with what we do in all things, fascia connects us from head to toe. So it's not even just about the way the rib cage collapses into the core, it's about how the lower body pulls the entire body out of alignment, which is why in block therapy we address the full system. But this is something that you can do right away, and you should notice a shift in how that feels almost immediately.
Right, because we're not addressing necessarily the cause of jaw pain. We're addressing more the pain right now, which is still gonna give you definitely a benefit and some relief in that area. But also, what about even like sculpting a jaw? So for myself, I think for a lot of people, we want to have more of a cleaner looking jaw. We do talk a lot about the tongue, and if the tongue muscle is not used and positioned correctly, it can give that appearance of a double chin, which is more so a displaced tongue, and then the fascia gets displaced, and then it just keeps building and accumulating. So doing this alone, and then even the combination of that tongue work, which we have talked about in a previous video, that's going to really help clean up and sharpen up the jawline. And I've noticed massive changes. So give that a try if you have jaw pain, or even if you just want to improve the appearance of your jaw. Let us know if that's making a difference for you, because a lot of people in our community are noticing a big difference. So yeah, that's everything. Awesome. So again, any questions or comments, leave them below. Make sure you give this video a thumbs up, and then subscribe, and then hit that bell so you're notified when we keep uploading videos like these. So we will see all of you in the next video.